people, welcome back to another video. This is 247 Onliners, and today we are going to focus on wound care after circumcision. So guys, this is a very exciting season in our country whereby there is rite of passage for our boys who are transitioning from grade 6 to junior high school. Others are transitioning from class 8 to form 1. And the last category is transitioning from Form 4, those who did Form 4, to college or university. So guys, what that means in our country, the transitioning from being a boy to a man, it means that these boys have to undergo circumcision. That means they have to face the knife, and facing the knife is undergoing circumcision. So guys, the parents, the caregivers, and also the medical students, they need to learn something from this video on how to take care of these wounds so that they can heal faster and with no advanced events. So guys, enjoy the video. If you find the video interesting, educative, please share with the parents, the caregivers of the boys who have undergone circumcision. So guys, let's get to know how to take care of this wound. So now, after the circumcision procedure, the patient or the boy or the man who have undergone the circumcision is supposed to rest for 30 minutes before going home or exiting the facility. This will give room for the surgeon or the doctor who did the circumcision just to assess if there is any immediate advanced events that have occurred after circumcision, and if there is any, this doctor will handle it and our boys or our man will be all right. So now this patient is supposed to be put on some pain medication, at least to relieve pain. At this point, no patient is supposed to feel like a lot of pain. You need to take medication or pain medication just to relieve that pain so that the patient is comfortable. Then, if this patient after going home, they develop unusual swelling, unusual bleeding, or the pain is not relieved by the pain medication that they are given by the doctor, they're supposed to go back to the clinic. And then there's that dressing that covers that wound after circumcision. You're not supposed to soak it with water. So if the patients need to take shower or to just clean up themselves, they just need to take a towel or a clean cloth, then they soak it with some water, and then they just wipe themselves. They're not supposed to soak that cloth before the third day or before the removal of the clothing or the dressing that covers the wound. Now, there's that materials used to suture that wound, so it doesn't break even if somebody has an erection. And the materials that is used for stitching the wound, it's not removed at any one point, so the body will have a natural mechanism of absorbing the sutures, so it's not removed, it's the body that absorbs it itself. So now the wound, the dressing, removal of the dressing is done on the third day or as instructed by your doctor, that is on the third day. And if the caregiver or that patient or the parents find it difficult to remove the dressing, they're supposed to go back to the clinic to be assisted by the doctor or the nurse who did the circumcision. And you're supposed to keep your genital area dry and clean to avoid any infection, and you're not supposed to apply any herbal, any concoction, any ointment, or any medication that is not prescribed by your doctor. So you stick to what your doctor has prescribed for you, and also the doctor prescribed for you an antibiotics for a period of, I think, 5 to 7 days. So you're supposed to finish your antibiotics for 7 days, and you're also supposed to support your penis with your underwear. So you're supposed to wear it swelling. It's not supposed to dangle down. So support your penis with the underwear to avoid it swelling. It's not supposed to dangle down until it heals. Supposed to have sex for 1.5 months, that is 6 weeks, even though your penis looked healed or it's not painful. Then you're supposed to go for a review, or the second review, on the 7th day counting from today. That is when the circumcision was done. I think that is all about our wound care after circumcision. If you have any question, if you have any comments, please let's engage each other. And you find the video interesting, please also share with people who really need it, the parents, the caregivers, and also the patients who have undergone circumcision. So for now, until another time when you have another video, bye bye, see you then.